What's going on, folks? Welcome to the Dr. Kamal Jones Show. I am Dr. Kamal Jones. It's wonderful to be with you for another episode of our podcast today. If you are not already following, make sure you follow on YouTube, like the channel on YouTube, subscribe, follow us wherever you listen to podcasts. Happy to be hanging out with you another Wednesday. On today's episode, we're going to be talking about this announcement from the Department of Justice that just came out, that they had made over 450 arrests related to over $6.5 billion of healthcare fraud across our country. They had international cooperation. They had national cooperation among over 45 states. This was a really big deal, what just took place by the Department of Justice. So let's dig into it and what it means for our healthcare system at large. So on June 23rd, the Department of Justice let out this announcement that they had made over 450 arrests related to healthcare fraud across the country. They arrested doctors, they arrested executives, they arrested nurse practitioners, a whole host of individuals in a operation to really pin down fraud that was taking place across Medicaid, Medicare, a number of healthcare centers. This was a historic level of arrest that was made. 56 federal districts, all 50 states participated. Of the individuals that were arrested, over 90 of them were physicians and other licensed medical professionals. The other 350 or 360 or so were executives or other people involved in healthcare administration. Let me break down some of the cases that were brought to charge here because a lot of these were really, frankly, awful cases. We have a case of a corporate executive in Arizona who allegedly took more than $1 billion of taxpayer money. They billed for these wound grafts that they never did, and they charged more than $1 million per patient for these wound grafts. This was all fraud. This is stuff that they just made up. They made $1 billion off of taxpayers. They allegedly used that money to buy $1 million homes and luxury cars, and they even bought a hotel in the Philippines, per reporting. Another individual was charged with fraud related to homeless individuals. They were bribing homeless folks to stay at these hotels, and then they were charging Medicaid for these crisis intervention services that the individuals didn't receive, didn't need. They made $49 million off of Medicaid with these fraudulent billings, fraudulent charges for crisis intervention. In Florida, there was a number of athletes who were going through health clearance exams who were forced or directed, I should say, into procedures that they didn't need. And in fact, because these folks were just sort of rubber stamping at the end of the day, the results of these physical examinations, there was an athlete who had a heart condition who was passed forward to go ahead and get clearance, and they actually died from this heart condition that was not discovered because of fraudulent activity that was taking place. There were lives that were lost because of this type of activity. So all told, billions of dollars of fraudulent charges were made by these individuals, people getting rich off of the system, and we are seeing in this really a unique cooperation across party lines, across state lines, with trying to hold individuals and systems, from physicians and nurse practitioners to medical executives and healthcare executives, to hospice owners, to anyone who is defrauding the system. This was a move by the Department of Justice under this current administration to hold these folks accountable. Now, if you know me, you might be asking, Kamal, why are you celebrating something that this administration has done? And I think it is important to the very ethos of what we're building here. This is not partisan, the work that I'm doing. Now, it will probably lend itself in one direction more than another, right? I am a progressive individual. I stand by that. But if somebody is doing something right to build a better healthcare system, to remove greed and to root out corruption in our healthcare system that is supposed to be here for the uplift of people, for caring for our well-being, I'm going to celebrate that. Now, it can be hard, right? Especially in this administration, when you see leadership like a president and the family of the president that are taking every opportunity to enrich themselves, right? It feels contradictory, and it's because it is. It's because it is hypocritical administration-wide. But it is always the right time to do the right thing. And in this case, the Department of Justice is doing the right thing. I believe these individuals need to be held to account. And here's why. When people take advantage of our systems of healthcare, these are not victimless crimes. They are stealing out of your pockets and mine to enrich themselves. They are taking away from resources that are there for the benefit of our communities and of our greater good. They are the reason, or part of the reason, that we're not able to have access to the types of services that we need, and why our healthcare systems are often in such a financial crunch. If we want to have a system that really works for us, part of the work that we need to do is going to be holding these bad actors to account when they take advantage of our system, and figuring out how do we close the loopholes that exist in our system as it stands today. I think it's important, though, to also acknowledge that part of the reason that we have such significant loopholes in our system is that our healthcare system is so ridiculously complex. And when you have such an arduous level of complexity, you create a landscape that is ripe for being taken advantage of by people who are greedy and who do not care about the well-being of their neighbors and only want to line their own pockets. You know, part of my disposition towards a Medicare for all system is that a simpler system is more direct in management. When you have a whole bunch of various insurance companies who are existing all throughout the country, and we have this sort of patchwork of insurance companies that people are receiving their healthcare through, you are ripe for opportunities to take advantage of those, right? The part of the reason you were able to have such a massive number of arrests is because it was all focused on the government-run systems, the Medicaid, Medicare, and other sort of government-affiliated systems. This is a simplicity that allows for actual management and actual maintenance of the integrity of the system. You know, the last thing I want to say is this. The executives who were involved in this, it's deeply shameful. And I'm happy they are all being held to account. And I, frankly, as a person who has my qualms with the system of mass incarceration and the system of justice in our country, throw the book at them. Because if you are going to steal from people in this country, if you're going to take from their tax dollars, from our tax dollars, to line your own pockets and actively be taking away from money that is designed to help the healthcare and the well-being of individuals all throughout our country, of children, of families, of individuals all throughout our country, then shame on you. And you deserve to be held accountable. But those physicians and other licensed medical professionals, to say that I'm deeply disappointed, not shocked, because there's greed in any human being, but deeply disappointed to see such greed among people who took an oath, right? These executives don't get off scot-free by any means. But if you took an oath to first do no harm to your patients, if you took an oath to heal the sick, if you took an oath to do what is best for the well-being of those who you care for, and you are blessed and privileged with the opportunity to care for your fellow members of your community, and you take that as an opportunity to steal from them, to take away from their health care, and to make yourself rich, you don't deserve to carry that license anymore. Shame is not a strong enough word for what these individuals should be experiencing. And I look forward to them no longer being part. If they go through their process, are found guilty, because we all are innocent until proven guilty, or ought to be in this society. We have a process that ought to be in place. But if they are indeed found to have done the acts that they have been accused of, you do not deserve to carry forward in this field anymore. All right, my friends, that is our episode today. Thank you, as always, for tuning in. Please make sure to like the episode, subscribe to the channel. Definitely check us out on Spotify, on Apple Podcasts, wherever you enjoy your podcast. Check us out on YouTube and leave a comment. You know, maybe am I doing too much, right? With my belief that if someone's crossed this line, they should lose their license forever. Do you think there's a path forward, especially for the practitioners who have crossed this line into fraud? Or do you think, similar to me, that this is a one and done sort of situation? I'd love to know your thoughts. And we'll see you next week, Wednesday. This is the Dr. Kamal Jones Show.